Good afternoon and welcome to the Department of Behavioral Health Weekly Update. I hope your week is going well. Starting out, a reminder that we are still in Pride Month. It's our last weekly update of Pride. And we have one more event, the Friday, Friday, June 25th, is a Facebook Live on improving care through understanding the intersectionalities of LGBTQ plus persons served. So tune into that. It's YouTube and Facebook Live, and that should be a great event. All right, COVID by the numbers. We now have 179,281,000 cases of COVID worldwide, with 3,884,800 deaths. In the United States, we're just over 33.5 million cases and just over 600,000 deaths. In California, we've increased to about a 1.1% positive rate. That's a minor increase from 0.9 where we were at last week, but something that we'll be watching closely, especially as we begin to experience more of the Delta variant in California. We are now over 40,724,000 doses of vaccine being administered. In Fresno County, we're just under 103,000 cases now. We've been creeping through the 102,000s at a much slower pace than we were before, and 1,724 deaths in Fresno. So that number does continue to creep up as well. Our hospitalization just hovering around 46 this yesterday, so in mid-40s. We have 7 in the ICU, 22 available beds. So over the past several weeks, we've hovered between mid-40s and mid-50s. Vaccination update, 868,099 doses of vaccine administered through earlier this week. We now have a little over 52%, almost 53% of those eligible for vaccine are vaccinated, and just under 50% for everyone. And of individuals over 65, 84.1%. So we continue to creep up there as well. So overall, cases continue to stay trended down. Hospitalizations are stabilized in the mid-40s. Deaths have slowed, but they do continue. And vaccinations continue to be significantly slowed. We had just under 9,000 doses given last week, and so that's well off our peak when we were doing upwards of 40,000 doses a week, but they are continuing. Some of those, as you saw from a prior slide, are individuals. We have over 77,000 people who've just received their first dose of vaccine, so we will expect that number to trail off over time of those individuals getting their second dose of a 2-dose vaccine. Nationally, we continue to see downward trends, but we are seeing pockets of surges, which I'll talk about in a minute with the Delta variant. It is unlikely that we'll hit the stated July 4th goal of 70% of adult population in U.S. to be vaccinated, but we will hit about 67%, so we're not too far off. And it's really individuals 27 and older that we're closest. The population between the age or under the age of 27, so young adults, seem to be carrying on the path of they're invincible, they don't need the vaccine, or they may have some concerns about the vaccine. But the population at highest risk now as we move forward are the unvaccinated. So the Delta variant. It is now responsible for 20% of U.S. cases, and I want to emphasize this, that in the last 2 weeks, its prevalence in the United States has doubled. So a couple of weeks ago, we were at about 5 to 10%, and now we're at 20%. It is anticipated that eventually this will become our highest variant in terms of prevalence in the United States, much like it's doing in other countries. And it is considered our greatest threat at this point to eliminate COVID-19. In Scotland, they did find that people with the Delta variant were twice as likely to be hospitalized as those with the Alpha variant. And right now, the Alpha variant is the predominant variant in the United States. And the Delta variant has become the predominant variant in Britain and India, as well as Russia. And as a result of that, in England, they have extended their restrictions another month. They did that last week because they're seeing this surge in cases because of the Delta variant. By and large, those surges are happening with unvaccinated individuals. So they still believe that the vaccines are providing some protection against the Delta variant, much more so than individuals who are unvaccinated. China also reported they have some surges in part of their country that people are getting sicker faster with the Delta variant. So it's considered more transmissible. It may be able to partially evade antibodies, so people who've had COVID before or been vaccinated could get the Delta variant. It may cause more serious illness and may render monoclonal antibody treatments less effective. Those are one of the treatments we have that has been found to be effective, and they're not sure how effective they're going to be with the Delta variant. So that's why it's a variant of concern, and that's why we continue to strongly encourage people to explore facts, understand risks and such, and consider getting the vaccine to protect yourself. All right, return to on-site work. This is going to be the main topic of my conversation today because we did get the Cal OSHA guidance, and so I do want to go through that. Fresno County will be having new rules, and when I say Fresno County, I mean the county of Fresno as an employer will have new rules. It is possible that the county will also issue health orders with new rules, but right now I'm just talking about as an employer, the county of Fresno is implementing some new rules. These apply to general county building settings, and I have gotten some questions which I'll answer through this, but I'll also touch on when I get to my question slide about, wow, what do we do if the rules are different in one setting versus another? And we'll talk about that. Healthcare settings, by design with the Cal OSHA guidelines, do have their own rules. And at least part of our department is considered a healthcare setting. Any place that we currently are serving the population we serve and or having members of the public routinely visit for services of some sort will be considered a healthcare setting. Over the next week or so, we'll define that very specifically. So for instance, the building I'm in right now, the Health and Wellness Center, the Hawk, will it be considered a healthcare setting or not? And I'll talk about what the differences will be in just a second. For any setting that is considered a healthcare setting, all employees are expected to be masked and maintain a 6-foot distancing. Any exceptions to that will be published when we publish our return to on-site work plan. And when we say all employees, we mean even any employee from another part of the county that's visiting. So if you're walking around one of our buildings and you see someone come in and they go, oh, well, I'm from DSS or I'm from probation or what have you, we just need to advise them that in a healthcare setting, you're required to wear a mask. And we'll talk about that. We'll have signage and such that says that as well. And then I'm going to talk about what the county's requiring, and I want to emphasize whether you're in a healthcare setting where everyone's required to wear a mask or not, you're going to have to follow the county rules, including self-certifying your vaccine status regardless of the rules in the area you're in. So if everyone's wearing a mask regardless of vaccine, we still have to follow the county rules. All right, so in terms of masking, fully vaccinated employees can go unmasked in many indoor and outdoor situations. The county has implemented a vaccine status certification process. Some of this is still in flux in terms of exactly how it will be carried out. So don't run out today and try and do it and give up. There's going to be a little bit of work that has to be done until it's smooth. So there'll be a question through the screening app. So when you go into the Go Fresno app, that allows you to self-certify that you're fully vaccinated, self-certify that you're not fully vaccinated, or you can decline to state. If you don't use the app, there's a form, a paper form that can be signed electronically and printed, or printed out and signed. If you decline to state, you will be considered unvaccinated for the purposes of the standards. So if you And you're required to fill out the form regardless. And so anything that applies to unvaccinated individuals, if you decline to state, you just don't want to tell anyone your vaccine status, perfectly fine, you're right, you'll just be treated as unvaccinated. We aren't asking employees for proof of vaccination at this time, but both the form and the app do mention that documentation of vaccination could be required at any time. So you should be prepared to demonstrate your vaccination status if you're going to declare that you're fully vaccinated. Unvaccinated employees, any staff, which includes people declining, as I stated earlier, will continue to use face coverings in all indoor settings except when alone in a room, alone in a vehicle, eating or drinking at the workplace where 6-foot distancing is kept. So you would not be expected to observe anyone eating or drinking when they're with anyone else within close distance. So I know I got that question. I'll address it again in a few minutes, but we would expect anyone who's unvaccinated to only take off their mask to eat and drink when they are far apart from other people. And then when communicating with a hearing impaired person where their ability to see the mouth is essential for communications, and for specific tasks which cannot feasibly be performed with a face covering, or tasks where a mask would endanger the worker. Neither of those, I believe, apply to our setting, but that's in there for other settings. Okay. If you are exempt from taking the vaccine because of a medical or mental condition or a disability, you have to fill out a face covering, or exempt from wearing a face covering, I'm sorry, and you're unvaccinated. You have to fill out the face covering exemption medical certification form and then contact your supervisor for an accommodation process. I'm not going to go through that. That's something that you just need to know, that if you are declaring that you're unvaccinated and you believe you should not have to wear a mask because of these medical conditions or disability, you need to work with HR on that. All right. During outbreaks, everyone will wear a mask. So we will be tracking, we'll still be testing. You will still be expected to self-report if you have COVID. And that's whether you're vaccinated or not. And then there's some definitions here of face coverings, and all of this is going to be provided to you, so you don't have to write it down, or maybe you could take a picture of it, I guess, if you wanted. But basically, the types of things that it has to be a 2-ply mask, it has to cover your mouth, etc., have hooks around the ears or behind the head, no holes or openings, you can't have that valve on it, it has to cover your nose and your mouth. Neck gaiters, scarves, ski masks, balaclavas, bandanas, turtlenecks, collars, or single layer cloth face coverings do not count. They don't matter. You will not be in compliance if you have one of those on. And again, you can't have the exhalation valve. I know those masks are more comfortable, but if you have COVID, you're just shooting it out at everyone through your mask. So that's not going to be allowed. And then again, there will be some locations that will require you to be masked regardless of your vaccination status on public transport, indoors in K-12 schools, childcare, other youth settings, healthcare settings, including some of our county health facilities, as I mentioned earlier, our correctional facilities and detention centers, including the county's adult and youth custody facilities, are required to wear a mask. Homeless shelters, emergency shelters, and designated cooling centers will be required to wear a mask. If you are unvaccinated and you work indoors or in vehicles with others, you can request the county to provide you a respirator, otherwise known as an N95 mask. And we will have a process that we will go through to make those masks available to you. And what you'll have to take a training video on how to safely use an N95 mask, etc. But those will be available to you. If you're vaccinated, you don't have to quarantine, even if you have direct contact with a COVID-positive individual, unless you have symptoms. And then you can remain in the workplace so long as you don't have symptoms if you're vaccinated. If you are unvaccinated, you have to follow all the usual quarantine requirements. And then, even though physical distancing and barrier requirements in the Cal OSHA guidelines we're pretty much lifted except in cases of an outbreak. We're going to maintain those in the county generally. So I'm going to go through some additional notes here that our own Helen Herrera provided me because she went to a meeting this morning. The Go Fresno app is being updated and we'll have a list of buildings and their unique face mask requirements. So for instance, if it's considered a healthcare building or detention center, when you go into your Go Fresno app and you fill out the screening and you indicate what building you'll be going into, it will tell you what those requirements are so that you'll be prepared. And then vaccine status verification, we're still required to fill out the Go Fresno app health screening questions. Please do not come to work sick. If you fill out that screening form and you're sick, I hope you're not at work because that will not be okay. Our own HR department will track vaccination status as reported through the app or through the form, and that will be kept in a HIPAA-protected environment. And then, again, clinical settings where are considered healthcare. We'll do a little bit of work internally to determine whether or not some of our buildings where no care provision is happening, whether we'll consider them healthcare or not. And so hang tight on that. If you're sharing a county vehicle with another employee or a client, just utilize your face mask, crack a window, and use air from the outside. And all of those details will be in our return to on-site work plan that we're finishing up right now. Contact DBHHR if you want that N95 mask. Again, you will have to have a training prior to utilizing an N95 mask, and we'll have that available. Again, work with DBHHR if you want to request an exemption to masking. If you've unvaccinated or have declined to state and you don't want to wear a face mask, you have to fill that out and fill out that medical exemption form. Okay. So again, we're going to require masking for all during this initial phase until we sort through some of these details. There is a team feverishly working on making sure that that return to on-site work is easy to understand, accurate, and consistent throughout the document, and we'll get that out as soon as possible. All right, questions. I did get these questions, and even though some of them may have been answered in my presentation I just gave, I want to make sure that the people who ask them see them and know that we're attending to them. What do we do if we're working in a county or a non-county building where the mask policy is different from our department? You would follow whatever it is in that building. So for instance, we wear masks in our building, but if I go to the grocery store and they don't require a mask, I don't have to wear a mask. It's really building specific. So whatever the requirements are in that building, that is the requirements you follow. If you're vaccinated, a lot of those buildings won't require you to wear a mask. Pretty much if you're unvaccinated, you should be wearing a mask everywhere. And then how will we handle breaks and lunches and vaccination status? So again, you know, if you're in a setting, regardless of the setting, healthcare or otherwise, if you're unvaccinated, you should be wearing a mask. So if you're sitting down and you're eating and you're unvaccinated, please do not sit with anyone else because you'll have to take that mask off in order to eat and drink. And so we need you to keep 6-foot distance. And that includes if you're sitting with someone else who's unvaccinated and the two of you decide, hey, we're okay being exposed to one another. We are not okay with that because we can't risk that you're going to give each other COVID and create an outbreak in the work setting. So in a workplace setting, we will not tolerate people who are unvaccinated being unmasked in close proximity to one another in a break room, for instance. You'll need to keep separate. That's just the way it is. And so that's the questions that I got last week or through the week. And so I will now go to, yep, there's no questions up there. Let's see if there's any questions okay, let's see. All right, this is a question. Will they, the higher ups, take into consideration those of us that fall into the higher risk due to comorbidities signed by our doctors? I'm not exactly sure what this means, but I'm going to take a stab at it. I think that this person is saying, I'm higher risk for if I get COVID, it would be worse for me, and how will we be handled? Well, again, we advise everyone to get vaccinated, and certainly, work with your doctor on that. If you choose to be unvaccinated, we would expect you to wear a mask. You're welcome to ask for an N95 mask. And I would highly recommend that in whatever setting you're in, work or otherwise, that you keep masked and you keep 6-foot distancing to limit your risk. So anybody who's, feels that they're in a health situation where they're at higher risk for getting COVID, it's going to be the most important for you to follow those precautions that have protected us throughout the pandemic. So please continue to follow those precautions. Is there any funding to have any type of DBH work mask for employees, or maybe we could purchase? We do have some masks available, like 2-ply cloth masks, and so I can, look into making some of those available if people just want to have, extra masks, or you don't have enough masks, or you ran out of masks. We can make some masks available. So please talk to your supervisor, and DBHHR facilities and I will work on figuring out how many of those we have and how to make them available to people. So I'm okay with passing out all of those masks that we have. There was a period of time during the pandemic where we got masks for people, but a lot of people weren't coming to work. So I'm not exactly sure what happened to all of those masks, because we really couldn't pass them out to people when people weren't coming to work. So I'll look into that. I'm not sure what happened to those masks. I don't have any other questions right now. I'm sure that questions are going to come up about this Cal OSHA guidance, and particularly about the vaccination status and where you record it and how you record it. So if through the next week or two, as that guidance becomes finalized and information goes out to everyone, if you run into any problems, there's a glitch in the app, or you have a hard time printing out the form, or you're not sure how to fill something out, or you want one of those medical exemption forms, please feel free to contact DBHHR. They're working diligently to keep up to date with all of the rules and regulations and make sure that we can find the answers to your questions. And we will continue to work through this. As I've stated so many times previously, this is a rapidly evolving situation, and at times it's been confusing, frankly. And so there are going to be times where it's not quite perfect. We haven't quite figured it out, and so I will ask for your continued patience and flexibility. If you see something that concerns you happening in your workplace, and you want some help, please contact your supervisor or HR, and we'll look into it. Last week, someone mentioned that in their work area, the distancing signs had went down, and they were concerned about that. And sure enough, ITSD had went around taking those down, so we had to put them back up. That's okay. We're going to make mistakes, and we're going to fix them as they come up. So please point those out to us. Let us know if you have any concerns, and we'll just have a lot of grace for one another and get through this. And the other thing I want to say is that while I strongly believe and hope and pray that all of you will get vaccinated, I do respect your choice not to get vaccinated. I'm here to answer any questions that might convince you. We will not tolerate any sort of harassment, verbally or otherwise, of people who've made the choice to be unvaccinated. That's their right, that's their choice, and you should not be treated disparagingly because of that. You are being treated differently because that's what we have to do to create a safe workspace. So wearing a mask in settings where unvaccinated people don't have to wear a mask is simply a health and safety issue. And so we don't want you harassed, but at the same time, there are going to be some differences in treatment. And that's not just going to happen in the work setting, that's going to happen, in lots of settings. There's going to be places that you can go visit, or concert tickets and things like that you're going to have to show your vaccination status for. And my family is going to be going on vacation in the next few days, and I was purchasing some tickets at some of the events we went to, and some of them said, if you have a vaccine card, you can sit in these areas, or you can go to this event, and if you don't, you can't. And so that's just the reality that we're living in, and as we try to get this pandemic under control. And so if you feel that you're being harassed, if you feel that people are treating you poorly, then please bring it to our attention. But there will be some differences for you that we just can't get around when you're in a public health crisis. And so thank you for your understanding. What was the October 1st date? This question came at the very end of last one, and I don't really remember mentioning October 1st, so I don't know what that date was referencing, and if I said it, I'm not sure what it was related to, but there is no October 1st date that I'm aware of that has significance. So I apologize for any confusion that was caused if I said something about October 1st. And then there's also a question about childcare. So there are a number of resources for childcare that you might want to access. One is the Children's Services Network, and we will send out, when we send out the recording of this, we're going to send out this information. We'll send you the website and a phone number for Children's Services Network that has a whole list of resources for child care providers. There's also a Find Care, and that is at 559-456-8195. It also has a website. And so that we'll put in the email as well. And then First 5 Fresno County has quality care information on their website as well. So all of those resources for childcare, for those of you who are preparing to return to on-site work and maybe struggling with finding childcare, if you either had a childcare previously that no longer is providing it or such, or newly need childcare, we'll put some resources down there that you can, hopefully can assist you with finding childcare. All right. And then, okay, yeah. Another question about the October 1st. There was also a question about how will we know if someone is or is not vaccinated. You may not know. In areas where everyone's wearing a mask, we don't have a requirement right now that there's some sort of badge indication or such. We'll just require everyone to be masked. And if you're working in an area or you go into an area where people could be unmasked if they're fully vaccinated, you might presume that they're fully vaccinated if they're unmasked, but some people will decline to state and choose to still wear a mask. Again, there should be no shame, no harassment or anything like that of people choosing to wear a mask. I'm fully vaccinated, and I've still chosen to wear a mask in some public settings where I'm just comfortable doing it, and I don't see any reason not to. And so there may be some of your coworkers who are fully vaccinated who choose to wear a mask. They shouldn't be made to feel bad about that. There are people who are unvaccinated that will have a mask on. They shouldn't be made to feel bad about that. There are people who are vaccinated who won't have a mask on. They shouldn't be made to feel bad about that. We're just going to have to get used to this. We're going to have to get used to it that some people are going to have a mask and some people aren't, and that's the situation we're in. And so we shouldn't treat anyone differently. You shouldn't tolerate being treated differently, whether you're wearing a mask or not. It's just the nature of the beast, if you will. All right, let's see if there's any more questions. Oh, Helen got back to me. We have plenty of cloth masks. So if any of you would just like a cloth mask, you're not asking for an N95, please contact DBHHR and we'll be sure to get you a cloth mask. Okay, what about folks that are not vaccinated but had and recovered for COVID? Are we considered vaccinated or unvaccinated? You're considered unvaccinated. At this point, research has shown that the best protection from getting COVID is to be vaccinated. Even people who've had COVID, you don't get as good of protection from future COVID unless you're vaccinated. So if you've had COVID and you've recovered from COVID and you've chosen not to get vaccinated, that's fine, that's your choice, but you're considered unvaccinated, and for the purposes of this policy, you will be wearing a mask at all times. And so, having COVID does not equate to being vaccinated. You have to actually have the vaccine to be considered vaccinated. All right. Let's see. No other questions? More are coming in. Are fully vaccinated individuals still required to physically distance? We are, for now, going to keep the 6-foot distance in place, particularly because we're all wearing masks and we don't really know who's vaccinated. But as that changes, as we go through different phases, we'll alert you and give you feedback. According to Cal OSHA email that came out yesterday evening, there was a date and noted as July 7th to complete the vaccination certification. If you're fully vaccinated now and you fill out the form, then you're considered fully vaccinated. If you're not going to be fully vaccinated until July 7th or afterwards, then you can't say you're fully vaccinated until you are. You have to fill out the form. Whenever you fill out the form, you fill it out based on your vaccination status that day. If your vaccination status changes, you should update how you fill out the form based on your vaccination status. I hope, it says, are we all expected to complete the certification and or be vaccinated by this date? You'll be expected to complete the certification, and I don't have this in detail, and Helen, if you're listening and you want to answer this question, I'm not sure if you complete your vaccination status daily or weekly. I think something I read said it had to be uploaded to Maine HR at least weekly. But again, whenever you're prompted to complete your vaccination status, it should be what it is that day, not what it will be next week or by a certain date. So there's not really a deadline, if you will. We're not requiring people to be vaccinated, so there's not a deadline for the certification, or you're not required to be vaccinated by a certain date, and you're simply required to document your vaccination status based on your vaccination status on the day that you fill out the form. And so if you're not fully vaccinated today, but you are getting your second dose in a few weeks, you would just update that form once you are fully vaccinated. All right. I don't see any other questions, but again, I'm confident more questions are going to come in, and that's okay. We're here to take your questions, to answer your questions, to go get answers to your questions if we don't have them, and we welcome additional questions. We anticipate having many, many questions as we move forward. Please do not feel bad about asking questions, except for what about telework? Please, but don't, that's just a joke. You can ask the question. I'm just going to give you the same answer. Anyhow, please don't feel bad about asking questions. I want you to feel like you had your questions answered. I want you to feel like you had a chance to ask any and every question you have. I'm sure once we publish the return to on-site work, there's going to be more questions. So we're just going to keep meeting every single week and continue to answer your questions. During those intervening days when we're not doing this YouTube presentation, keep sending your questions to Tina. She shuffles them to me. If I have an answer right away, I'll try and answer you. If I don't have an answer, or I think it's something that will benefit everyone, I might wait till the update to give the answer, but please feel free to send us those questions between these presentation dates, and that sometimes gives us a chance to get information so that we can give you an accurate response once we do the update. And with that, YouTube. Oh, another YouTube. Once we return to work, if we feel sick, will we be allowed to work from home for the duration of the symptoms, or will we need to use annual leave? That's a really good question, and one that we have discussed with our leadership team, but I don't know quite what the answer is to that. This will depend somewhat on some county rules, and that's why I'm a little reluctant to answer the question, but I commit to you that by next week I will try and answer that question. Certainly the experience of COVID has given us a lot of telework experience, and so we just need to resolve, based on county rules and policies and such, how would that work for you to work from home while sick? We'll see. I think that some of it may depend on how sick are you versus are you just quarantining because you were exposed to COVID or that type of thing. And so we'll try and have some answers for you at the next update. All right, I feel like we need to just wait a couple more minutes because we keep having questions coming in. There's always, there's a little bit of a tape delay. So when I'm presenting and I look at the YouTube over here, I see myself from about, 30 seconds ago or 20 seconds ago. And so sometimes questions come in after I've already said, well, I don't have any more questions. So again, after this, please feel free to send us questions. Have a great weekend, and I will see you next week.